Good morning, everybody. Today is September 6th. We are 120 days away from the NEET PG exam. साथियों, आज मैं next 5 minutes में 10 points that you need to remember about the topic sarcoidosis. अच्छा, इसका importance क्या है? ये पैथोलॉजी का हाई यील्ड टॉपिक है, रेडियोलॉजी का भी और जनरल मेडिसिन का भी, इसलिए डेफिनेटली क्वेश्चंस विल कम. 10 पॉइंट्स, गर्मा गर्म पॉइंट्स अबाउट सार्कोइडोसिस. इट इज अ सिस्टमिक डिजीज which is the most commonly involved organ. Lung is the most commonly involved. What is the first manifestation of this condition? There is accumulation of mononuclear inflammatory cells, mostly CD4 plus Th1 type of lymphocytes and mononuclear phagocytes. They are the ones which get accumulated in all those affected organs. So lymphocytes, macrophages. These are the two things which are predominantly heroine of the sarcoid pathology. Now doctor, नॉन कैसिएटिंग ग्रैन्युलोमा. कैसिएटिंग ग्रैन्युलोमा कहाँ होता है? टीबी में होता है. इसमें नॉन कैसिएटिंग होता है. एंड यू फाइंड जॉइंट सेल्स. व्हाट इज द टाइप ऑफ जॉइंट सेल्स दे आर? लैंगरहैंस टाइप ऑफ जॉइंट सेल्स और द फॉरेन बॉडी वैरायटी जॉइंट सेल्स. एंड व्हाट इज द डिफरेंस? अगर आप लैंगरहैंस जॉइंट सेल्स देखें तो न्यूक्लियाई विल बी टिपिकली डिस्ट्रीब्यूटेड पेरिफेरली, whereas these are more phagocytic in, इसका phagocytic power ज़्यादा होता है Langerhans का. Whereas foreign body, all the nuclei are typically located towards the center. That is the basic difference. Now doctor, bilateral hilar lymphadenopathy. Another very important feature when you look at the radiograph. A lot of times these radiologist guys are the ones who discover this. Or whenever they discover bilateral hilar lymphadenopathy, what is the common 3 differential diagnosis? फटाफट बोलो. TB, lymphoma and sarcoid. These 3 are a very important differential whenever you find the bilateral lymphadenopathy, hilar lymphadenopathy is what you have to basically remember. Now, what are the 3 bodies you should remember in sarcoidosis? Shaman's body. भगवान श्री कृष्ण का कॉन्च होता ना, वैसा होता है आपका shaman's body, conch like structure. Similarly, stellate, star like shaped one, it is called asteroid body. Then ऐसे उठते हुए रिफ्रैक्टाइल होता है रेसिडुअल बॉडी, उठ के दिखता है, राइट? कैल्शियम कंटेनिंग इंक्लूशंस व्हिच आर रिफ्रैक्टल आर रेसिडुअल बॉडीज. नाउ देयर आर 2 सिंड्रोम्स एसोसिएटेड विद द एक्यूट सार्कोइडोसिस. एक लॉफग्रेन्स सिंड्रोम. व्हाट इज द कॉम्बिनेशन व्हिच इज कॉल्ड एज लॉफग्रेन डॉक्टर? एरिथेमा नोडोसम. Typically, there is a paniculitis, inflammation of the fat tissue, erythema nodosum, and on the X-ray you find a bilateral hilar lymphadenopathy along with the joint symptoms. So arthritis, adenopathy, erythema nodosum, इस तीनों को कंबाइन करके आप क्या कहते हैं? इसको Lofgren syndrome is what you have to basically remember. Now, what are the joints involved, doctor, in case of the Lofgren's arthritis? It is ankles, knees, wrists and elbows. Now, the second acute syndrome that you need to remember is Herford-Waldenstrom syndrome. ये अंग्रेजी वाले ये पूरा डिस्कवर करके टंग ट्विस्टिंग नाम लगाते. Lot of times I wonder how will the girlfriend of the Hereford will call him? Hey हीरा इधर आओ बोलेगा. So Hereford Waldenstrom syndrome. इसमें क्या होता है? कॉम्बिनेशन फीवर, parotid enlargement, parotids are both enlarged. Anterior uveitis होता है, anterior uveitis, and facial neuropalsy. This combination is called as Herford-Waldenstrom syndrome. Lot of times examiner asked this question. Bhaiya, sarcoidosis mein, which is the cranial nerve involved. What will you remember next time? Facial nerve palsy is a feature of sarcoidosis. Then one very important cutaneous manifestation, lupus pernio. आप लूपस वल्गैरिस बोल के सुना ना? लूपस वल्गैरिस होता है टीबी में, लूपस पर्नियो होता है सार्काइडोसिस में. So how will be the lupus pernio lesions? They are indurated, hard, blue purple in color, swollen, shiny lesions which are present on the nose, cheeks, lips, ears, fingers and knees. You have the lupus pernio, which is the typical lesion of the sarcoidosis. Now, eye involvement. About 1/4 of the patients of the sarcoidosis will have eye involvement. It can lead to blindness. Oh my God. Then 75% have anterior uveitis, only 25% have posterior uveitis. भैया anterior क्या होता है, posterior क्या होता है uveal tract में? Uveal tract में क्या क्या रहता? Iris, then ciliary body, choroid. This is basically called uveal tract. आइराइटिस हो गया तो उसको एंटीरियर यूवेटिस कहते हैं. कोरोइडाइटिस रेटिना के बहुत नजदीक में रहता है. कोरोइडाइटिस हो गया तो इट इज कॉल्ड posterior uveitis. That is less common, but anterior uveitis is more common in the case of the sarcoidosis, is what you have to basically remember. Now, because of that uveitis, what will be the clinical presenting feature? Blurring of the vision, tearing, photophobia, etc. etc. Now, sarcoidosis may the lacrimal gland is involved, so the person cannot be able to shed tears. There is a keratoconjunctivitis sicca syndrome with the dry sore eyes, and typically parotid involvement hota hai. Because of the parotid involvement, xerostomia can occur. Because of that, a cracked tongue, dental caries, they are all the possible features. And typically parotid is bilateral involvement is the rule, is what you should remember. And what type of parotitis, doctor? Non-tender, firm and smooth parotid enlargement is what you typically come across. Now, what are the common abnormalities that you find in the blood in case of sarcoidosis? Lymphocytopenia, eosinophilia, increased ESR, hyperglobulinemia, just like in multiple myeloma, then increased angiotensin converting enzyme, and there will be a false positive rheumatoid factor that adds to the confusion. भैया sarcoidosis में arthritis है, rheumatoid arthritis में arthritis है, दोनों में arthritis है, मगर sarcoidosis में false positive rheumatoid factor है. That adds to the confusion when you are clinically diagnosing. Similarly, anti-nuclear antibodies, SLE में arthritis है, sarcoidosis में arthritis है. Unfortunately, SLE के जैसे sarcoid also can lead to false positive test for the ANA is what you should remember. And very important, doctor, hypercalcemia is what you see in case of sarcoidosis. Then Queen Sidzebach skin test. It is an intradermal injection where you are giving a heat-treated suspension of a sarcoid spleen extract which is being biopsied, which is later biopsied 4 to 6 weeks later. Once you give this heat-treated suspension of sarcoid spleen extract and do biopsy after 4 to 6 weeks, it will show sarcoid-like lesions, which is the proof. So that is the Queen's Sidzebach skin test, which is an intradermal, not subcutaneous, intradermal injection is what you have to ultimately remember. So finally, if I ask you a question, what is the confirmatory test, doctor? So many tests bola aapne. Biopsy is the confirmatory test. And very important is eggshell calcification of hilar lymph nodes is a feature. भैया एग शेल क्या होता है? आप एक बार अंडा ले लो, उसका शेल को देखो, कैसा लगता है आपको? थिन रहता. एग शेल इज वेरी थिन. So that is the reason when the margin of the calcification, typically when the calcification is there and the margin is very thin, rim is there, that is called eggshell. But eggshell is not only seen in the case of the sarcoid. Please don't forget, Dr. Silicosis. Sarcoid, eggshell ke nakkar. Treatment of lymphoma, you have done radiotherapy. Eggshell ke nakkar. Advanced pulmonary disease in sarcoidosis. Please remember, early stages of sarcoidosis, you don't have eggshell. Only when it has reached advanced stage, then only you have the advanced pulmonary disease in sarcoidosis, you have the eggshell. Kohlwerker pneumoconiosis, you have eggshell. Scleroderma, you have eggshell. So ये सारे चीजें बट्टी मारना पड़ता है. एग्जामिनर का फेवरेट क्वेश्चन है रेडियोलॉजी में, tell me the causes of eggshell calcification. You have to be very sure about. So one small commercial, doctor, please don't forget, Dr. Murali Bharadwaj Super 2000 NEET PG WhatsApp study group में join हो जाओ. MCQs मिलेगा, videos मिलेगा, study mates मिलेगा, right? Handwritten notes मिलेगा. And every day evening, please don't forget, tune yourself, 7 p.m. to 11 p.m. We have a live YouTube broadcast on the youtube.com/onlinembbs. And also, you request for subscription. You buy the subscription on the video library of onlinembbs.com. Call 900868 So this is Dr. Murali Bharadwaj, your roommate, your benchmate, your YouTube mate, your WhatsApp mate to become the topper in the NEET PG exam. Thank you very much.